Thank you so much for taking time out for one of our exciting initiatives that we have started at SIIC. And it's been over 3 years now that we've been continuing the Tech Talk series. So before I get into introducing Professor Amitabh Bandyopadhyay and Professor Sukumar Methi, I would like to give a brief about the whole initiative. So, and by the way, I am Aditi and I've been part of the Startup Incubation and Innovation Center for last 4.5 years now. So Tech Talk was conceived back in 2017, where Amitabh sir was trying to make an attempt to create a bridge between the engineers and the medical fraternity of the community of the country. So we started with this concept of Tech Talk with a Dog, where we invited doctors and clinicians from different expertise, and they addressed our faculty members, our students, our startup community by sharing different kind of problems they encounter during their daily life that can be solved with engineering interventions. Tech Talk, so slowly Tech Talk with the Dog evolved into a bigger concept, which we now call it as Tech Talks. So here we invite industry experts, and the industry experts can come from any industry, agri-tech, medical devices, energy, etc. And these industry experts share their problem statement and pose it to the entire, make it public to the entire IIT Kanpur community and seek engineering innovative solutions to that. So for today's session, we have been joined by Professor Sukumar Methi. Before that, I would like to introduce Professor Amitabh Bandyopadhyay also. He is a professor at the Department of Biological Sciences and Bioengineering, IIT Kanpur. And he has been leading the Startup Incubation and Innovation Center as a professor in charge since 2017. Sir, would you like to give a welcome address before I introduce Professor Sukumar Methi?
Yeah, sure. So, to all the attendees, friends, colleagues, students, the idea is fairly straightforward that within an engineering institute, we have a lot of skill sets and we can make things, but often because of our limited worldview, we do not know exactly what to make. On the other hand, there is a whole world out there where champions such as Professor Sukumar Methi, they are trying to bring in real life changes in the lives of Indians, and for that they need implements, and these implements can be fabricated by us. Like, they know what to make, but they do not necessarily know how to make it. And within the campus of IIT Kanpur, there are many of you who know how to make things, and the Tech Talk is just an attempt to bridge these two different worlds, where the need statement comes from outside and the solution comes from within. And SIIC has committed certain funds and other facilitation to ensure that if you take up a problem statement, you can actually deliver the solution for it. So today, as I wrote in my email, that Professor Methi has enormous experience of working for the villagers, particularly when they come, there is a need for surgical intervention. And you can imagine, the ground reality in the villages of India, what is possible and what is not. But Professor Methi knows it from first-hand experience. And he has several ideas on how we can possibly solve it. And I would request that all of you please listen to him carefully and come up with solutions, and SIIC will help you implement those solutions, of course, with help of Professor Methi and his colleagues. So with that and a lot of anticipation and hope, I would say that let the TikTok for this evening begin. And I would request Aditi to kindly introduce Professor Maiti to the audience. Thank you, Aditi.
Thank you, sir. So now I would like to introduce Professor Sukumar Mehti to the audience. So he's a professor and head of the Department of Surgery, Eye Care Medical College, Haldia, West Bengal. He has demonstrated an exceptional skill set in the medical practice industry consistently. He's also skilled in clinical research, medical education, pediatrics, hospital, and medicine. So you can imagine the kind of experience he comes with and the kind of problem statement he would be sharing with us today. He also has an extensive teaching experience in several reputed institutes, which include IT, PGMR, and NRS Medical College, Kolkata. With that, I would now hand over the baton to Professor Sukumar Mehti. Sir, please enlighten us on the entire field of rural surgery and the problem statements, the problems that clinicians like you have been facing. So over to you, sir.
Thank you, Aditi, for introducing me and telling many good words for me, and Dr. Professor Amitabh Bandyopadhyay. I am grateful for inviting me to this session of TikTok, unique session, unique type of session. I think this type of session should be organized in different institutions, not only in engineering college. I'm thinking I can organize in the medical college too. And actually the subject what you have given to me with the idea that from the perspective of rural surgery, how I can contribute or share my ideas with the engineers. The seed of this talk was actually before that I am sharing my slide. Okay.
Your slides are visible, sir.
Visible now? Okay.
Yes, sir.
So the subject allotted to me by Dr. Bandyopadhyay and others, Aditi, Shiv Kumar, that is the rural surgery then, now and beyond. This concept or the seed of this idea was actually arose from the Maulana Azad Medical College, New Delhi. Recently, we had a conference, international conference, Congress for Innovation in Global Surgery at the heart of the country, that is at New Delhi, Maulana Azad College, the premier institute. And there on 20th and 21st April, in that conference, not only the doctors from the rural areas, doctors from the urban areas, and the engineers, and your producers, that is the instrument makers, they participated, and I am happy there I could meet Aditi and others. There we could have the friendship with the participant from the IIT Guwahati, IIT Chennai, and many others. I think, I don't know, Aditi may say how many IITs participated in the conference. So there we had the opportunity to share. There was a session where the engineers and the medical professional can cooperate or collaborate to improve the healthcare system in the rural India. And in that discussion, I said that probably after returning from Maulana Azad Medical College to Haldia, I will talk with my friends who are working at IIT Kharagpur, which is nearest to my place, to have a joint workshop or seminar as it is in now going on at Maulana Azad. So that was the idea just entered to my brain, and I think Kanpur IIT is before that, and that has I have the opportunity now to sit with my friends in the Kanpur IIT to share our feelings and share our thoughts, and everything is aimed to improve the healthcare facilities in the rural area, and the people at large which are downtrodden, relatively poor, will be the beneficiary of that our progress in our implementation of our thoughts. and I think, I don't know, Aditi may be there. So these are they are some of the participants in that conference, including the representative from IIT, University of Leeds, representative of Australia, and many places of India. Now, aim of that conference was many: to strengthen the innovations ecosystem for the global surgery. And out of all these aims, one of the important aim was bringing surgeons, researchers, engineers, designers, investors, manufacturers, and also the policy experts on a common platform. And that was the first step. This type of international conference was the first step in a big forum, but I think in small forum like today's forum, there are the importance of this type of sharing of knowledge and ideas. So let us move to the subject, proper subject, rural surgery. The term rural surgery basically means the surgery which is being done at places far away from the metropolis. Today, with the development, overall development in the country, in true sense, those rural areas which in our imagination 20 or 30 years back is not present. Most of the rural areas are not so badly communicated as it was before. So, though the communication has developed, though communication by roads, communication by your media, communication by digitalization has improved, but till the science has not properly reached to the rural area. For the initiation of workers in the engineering field and the agricultural field, probably the science has properly reached to the rural areas in the agricultural aspect. You see, whatever development, we can think of green revolution, and that was only possible because science, knowledge, awareness of the cultivators was improved, and that could bring the green revolution, that could bring the white revolution in the form of production of the milk, and that has been achieved. But I think in the field of medicine, it is the thought which should be nurtured, and I think it is possible if all of us, including the doctors, engineers, policymakers, industrialists, all sit together, and that is possible, and to bring a change what is going on in the rural India. It was also true years back, thousands years back, that was also true in other countries like France, Germany, America, everywhere the picture was same. But the progress has now occurred, but basic science is remaining same. Basic science of surgery is same. Basic art is the same, but what can be achieved by the development or advances of science, advances of technology, that is the type of surgery, that is the way of surgery that is changed. That is we are thinking now the saving of working hours, how the pupil after getting the surgery can return to his normal work at his earliest time, so that manpower or working hour is not lost. So in that way there is a tremendous development all over the world, and in the cities the people are getting the advantages. So why not the rural people? So we should go for that. You see, now for a better treatment, the people had to be transported by vehicles, initially by your Dola and I think in India, but these are the improvements. But now it has come to this type of transport from the extreme remote areas to the big centers. But this facility is available only for few people. It is not for all. It is very costly. It is like a showpiece. It is shown, it is propagated that we are doing this for our patient, for our country, but truly speaking, majority of the people is not taken care of. They are getting the the lower grades of medical facility. So for that reason, we should think in other way. We should send the advancement of the medicine, advancement in engineering to the rural areas so that the people get the benefit in the reverse way. And that is possible. And that is possible, not impossible. And you see, this is the picture till in our country. This is the way of transport. But you see this picture. This is from my own place. I am from the rural area, from Midnapur district. And only few years back, 3 years back, it is see a pediatric patient. The boy had a fracture in the femur. So this is the treatment of traction. In hospital, we use different methods, beams, so many things for the traction, so that there is no movement of the limb remains suspended. But you see, the father of the baby child is a carpenter. He innovated a ambulance-like thing, a box. So the same box he just displays to his home where the baby and the mother can stay, and he is suspending this by rope to the overhead beam. So, and on the trolley he could bring the patient for the follow-up checkup. So what a innovative idea this person is having. The rural people, whatever may be his profession, are very innovative minded. They can be utilized in different way in our innovative works. And that's what I was telling, and this is one idea. When Aditi and we were in the Maulana Azad College, I was roaming the campus, and in the same campus there is the Dental Medical College, Maulana Azad Dental Academy of Science. So in that college you see the row of mobile medical van. Within the van there are all the facilities of the treatment for the dental care.
Dental treatment. They move to the rural areas.
So they are trying their best with the support from the government, from the institute heads, to provide the dental care in the rural hospital, in the rural places. It is possible for all branches of science. I know in Rajasthan there was a surgeon who is a urological. He is a urologist. He carries all the sophisticated equipments, including the ESWL, by which the stone in the kidney can be melted with ultrasound. Am I audible? I am talking.
Yes, sir, you're perfectly audible, sir.
Audible. Okay.
Yeah.
So dental, all the urological facility are carried from Jaipur to the extreme rural places in Rajasthan. So they are carried and they give the treatment. They take one school or colleges for the stay of the patient and make a makeshift hospital with all amenities for the toilet and other thing. But the hospital facility is mobile, and they come back after 2 or 3 days after observing the patient. What my appeal to the engineer is that, so you see, within this van there are so many gadgets, so many instruments they are provided. But I know by your designing, by your incorporation, you can make all these things folded one, and they can be accommodated in a small space. So the space saving equipments, which will take less space and more equipment can be carried to the rural areas, that can do a lot for the mobile medical vans. So medical and engineering collaboration, health care and the technology are changing very rapidly, and the future physicians and the engineers need intellectual tool to stay ahead of this change. So we should all think about it, and we should collaborate very, very efficiently, effectively and fruitfully. So create interdisciplinary teamwork to bridge the difference and to facilitate learning how to think critically and creatively to drive changes in this sector, that is the sector of medical care in the rural India particularly. Engineers and the medical professionals are as if sitting on the two sides of the sea. We cannot see each other. we are discussing, we are progressing, but there is lack of coordination, lack of collaboration. We need a wide bridge to fill the gap so that we can sit together, we can meet together and exchange our knowledge and experiences. You see, whatever the benefits we are enjoying in the medical science, almost all of them, majority of them are coming from the hard work of the physicist, the chemist and the engineers. The Leeuwenhoek first observed the microbes under microscope. Marie Curie, if she could not invent the radium, the so many cancer patients would remain untreated. And the basic science, that is the X-ray, as it was invented by Röntgen, he was a physicist. But you see, without X-ray, how we could reach in the medical field to such position? After this simple X-ray, there are so many developments like contrast X-rays, CT scans, and so many things. So now not only the X-ray, but the magnetic field is being used in MRI scans. The sound is being in ultrasound. So in this way, there is a rapid development in medical science, particularly in the 19th and 20th century. Today, we are in the age of ultrasound, color Doppler, in the age of virtual CT scan, in the age of capsule endoscopy, where capsule moves within the intestine, and what is the pathology, what is the lesion with the intestine will be gathered by this capsule, and this will be passed with the per rectum, and it will be collected, and all the information which is within the intestine will be collected from this capsule. But this technology, where it is, that is confined at least only in few institutes in India, only in few, that maybe 5, 10 like that. But it is possible to send this technology even at the district level. Why not? The technology, once it is developed, the application is not so difficult, and that can be applied with the wish, with the desire of the administrators, the policy makers and the industrialists. The cost can be made lower, and our Indian engineers are so educated and so intelligent, their ability is so high. I think they can modify, they can change, little change in the design of this capsule to make it cost effective. They should work over this. What is coming from the Western countries, they should work over it. What is it? What is inside? Whether with their laboratory they can make a change so that this technology can reach in the district level. That is the mode of application of this capsule is very simple, but the cost is very high. Similarly, this PET scan, PET scan is very costly now, but in future that will become the basic investigation for all cancer patients. I think in future the PET scan facility should reach even to the rural areas, and the engineers can do a lot in this field. You see here, engineer is John Reed, M. Reed is sitting with John Wild, a surgeon, and what they are discussing? They are discussing the echogenic traces with the probe of a tumor tissue, normal tissue and the tumor tissue, and they can discuss, they exchange their ideas, knowledge and their requirement, so that the engineer can then change a little to capture device, they can change, and so the capture will be more effective with more precision. And so artificial intelligence is now the day, and only thing, this artificial intelligence that remains very sophisticated, that any common people may think it is something, it is beyond our reach, it should not be discussed too much, but that should be the part and parcel of every medical college and every teaching institution as a basic curriculum, because in future artificial intelligence will solve lots of things where the expertise can reach even in the remote level, where who are working in the basic level, health workers, the engineers work in the basic level, they can get the experience of the very senior and expert one by this artificial intelligence, and the ultimate benefit will reach to the patient. And you see, regarding ultrasonography, you the engineers are working in your laboratory, extensively you are working from morning to night, and you are achieving great achievement, but and you know it is a development of science. Probably you are not getting the feedback from us that your discovery, your invention, your innovation may do a great job for medical science. What happened in case of ultrasound? What Lazaro Spallanzani identified that the bat, even its eyes are closed, it can move from one place to other without any obstacle. They can detect without their eyes because of their, that is ultrasound, which is from their wings they are generating, and with that ultrasound they can know where they are going. So that ultrasound was used in warfield, in the sea science, for identifying what is at the depth of the sea. But it took more than 150 years to know that ultrasound will be useful for the medical science. And it was George D. Ludwig, working in military as well as the medical science, military medical doctors. So he could say that yes, and he could utilize the ultrasound in the medical field. So in this way, there are many things happening in your laboratory with the engineers, and if we sit together, if we exchange our ideas, if we meet once in a year at least, or twice in a year, so we can change, we can see. Actually, yesterday I was talking with my friend who is working in the School of Medical Science and Technology in Kharagpur. I wanted to visit to the college just yesterday, but because of some exam, I had to just postpone the program. But I visited that college several times before, when I was working in Midnapur Medical College, that is a college, medical college close to Kharagpur Medical IIT, Kharagpur IIT. So we had some joint work on cancer of the breast and the squamous cell carcinoma. They studied on the proteins of the cancers on the breast carcinoma. So we had some joint work, and also 2 or 3 publications jointly with the School of Medical Science and Technology, Kharagpur. So I'm just telling what you are doing in the research. So we can organize with the adjacent medical college, you can organize the workshop, and you engineers, please visit our medical college. I would invite the engineers to my medical college to see what we are doing, and if they move, and their eyes will pick up that they can do some good things in this field. And what develops in the medical college, what develops in the IIT, that will reach again to the rural areas. And you see, in minimal invasive surgery or keyhole surgery, laparoscopic surgery, robotic surgery, they are the talk of the day. They are the demand of the day. And in the laparoscopic or keyhole surgery, many things has developed, but till the evolution is going on, there is lot of things which can be done in the field of hardware, in the field of hand instrument, so that this instruments, this big instrument can be made smaller and technology can be improved. Suppose the computers, the desktop, just think of the desktops, how big it was. Now our bigger size mobile is as good as your desktop of bigger size. So in this way, in the field of robotics and telemedicine, till the engineers have lot of work to do to give the benefits and ultimate these benefits. You see, I am now staying in a rural area. It's a very small nursing home, but I can do the laparoscopic surgery only because the instruments are perfect. There is no failure in the instrument. Once the instrument is good, and if you know the technology, and if you have the medical knowledge, why not? Everywhere a person who is reaching in the rural area, if he carries those instruments which are very sophisticated, which are very perfect, so the role of the engineers today should be to make the instruments very perfect. And another thing, to make the instrument cost effective, the instrument makers usually make some agreement, and most of the time what happens, the instrument makers try to replace the instrument with newer version, which is also another here's another cost. So my suggestion is that every medical college should have a department, engineering department. Every medical college in future, I hope it will come, as every medical college has a photography department, as every medical college has a sociology department. In future, every medical college will have a engineering department. Similarly, every engineering college in future, IIT particularly, will have a section of medical section, that may be in the form of medical college, that may be in the form of school of medicine or school of medical technology. So that is the future. I think the present India government is also thinking in that way. So that will come, and there the help of the engineers at hand in the institute, in medical college, will be a lot. If there, for example, there is a problem with the pulse oximeter, is there a problem with ECG machine, is there a problem with the digital information input to the computer, is there is a problem with artificial intelligence if it comes in future. So in future, it also increases a job opportunity for the engineers to the medical college. Similarly, a medical professional may be appointed to a IIT or engineering colleges. So in that way, it improves a job opportunity too. So what are the field of works in the rural surgery from the engineers? What we expect? We expect the engineers will do something so we can make the instrument at low cost. The investigation devices should be made very simple, portable and cost friendly. Artificial intelligence is the future of the day. Already my friend, one of my friends who is a professor in surgery, doing work on artificial intelligence with the IIT Kharagpur. My friend is working in NRS Medical College. So just a few months back, he visited the IIT and they had the discussion, and they have already started the project. Biogas, solar energy, these are not properly utilized. Every health institute, that may be a nursing home, that may be a small hospital, should have a proper biogas and solar energy plant, so that that power can be utilized properly in the effective way. Biomechatronics, that can improve the artificial joints and prostheses, metals, chemicals, which are bio-friendly to the human tissue. Much more researches can be oriented in this direction. So am I audible? Any question up to this, or shall I continue?
So please continue. We don't have any questions
Okay.
at the moment.
Suppose this is a small innovation, and my son is an engineer, NB Maiti. We designed a small instrument of a operation. Nothing. At the tip of the artery forceps, my son suggested that you put a blade. Before that, when the blades were apposed, it was very wider. It was very difficult to fit in the tissue. But what he has suggested, and I have just designed it from a small instrument maker, to introduce 2 plates. So with these plates, we very effectively and very simply we can spread the muscle in a pediatric operation, that is Ramstead pyloromyotomy. So in this way, there are different innovations. Here is an innovation by Dr. Ganraj. He came to a rural hospital for demonstration to the students, to the surgeons, that how without gas the laparoscopic surgery can be used. So this is the device of gasless laparoscopy, gasless laparoscopic surgery. This device, actually we organized a workshop at Medical College. I was the head of the department of Medical College Calcutta. There the people from Leeds and other universities, Australia, came, and here was a workshop, and the students were trained from northeast countries, northeast states, and they are now doing extensively this gasless laparoscopic surgery in northeast states. Here the problems with other instruments which are used with gas surgery, they are not there. So that is a useful device, and I think our engineers can make this device also very lighter one, but very strong. I think instead of this metal, they can make it from fiber. They are well aware of the they are well aware of different metals, so they can make this instrument lighter. Once I can remember, when this instrument was being used in a medical college, and because of some unawareness, this instrument fall from the table on the floor. When you are falling, that was on the foot of an assistant, and that caused injury to the foot of the assistant. So I think if it is made of fiber or lighter, that sort of accident will not happen. And artificial limbs, lot of work can be done for the development of the artificial limb. I think that is a big field, and our engineers can do a lot on this by digitalizing it, by introducing many things, incorporating many things into the artificial limb. Just yesterday a picture came in the Anandabazar Putrika, Rima Nondi, just how happy she is after getting a 2 limbs, after she lost the limbs after a COVID. So there was the thrombosis of blood vessel on both the sides, both limbs were amputated, and she was just too much frustrated. The doctors assured him, and ultimately yesterday she could stand on this artificial limb, which was brought and imported from Germany. So that is the thing. In our country, our PhD students, our researchers in IIT, they can do a lot to improve this type of artificial limb in our country too. So here is I am need of I am on a few minutes, 5 minutes. You see there is a fistula operation. So here is water coming out through the fistula. There is a big tract and also branches. When water is coming out, and when you are operating, we can know that there is a tract. But when you are operating, it may cut the tract. Say tract may be lost. So I am thinking and appealing to you, you just think about a metal which is liquid in a little higher temperature. For example, little more than the normal temperature. For example, in 39 degree or 40 degree, it is liquid. When you inject it, that will occupy the tract and its branches, and when it will come into the tissue, in contact with the tissue and in normal temperature, it will solidify. So what will make the surgeon easy, that he can follow that solidified area, and that will ensure that whole tract is removed. So my appeal, I think in future, I was very much, when I am operating, I was very much thinking that this type of metal, if comes, just like a wax. A wax is liquid when it is hot, but it is solid when it is in normal temperature. But wax is not so hard. Wax is liquid only in very high temperature. So I am alternatively, I am asking for a metal which is liquid at a little high temperature, but when it is solid, that is very solid in a normal temperature. So this is the School of Medical Science and Technology, Kharagpur, and these are the different laboratories, including they are working extensively in Kharagpur. I hope in Kanpur and other institute they have started, or already they have also the similar laboratories. And now Digital India is, by all the rural people are well connected in the field of maternal care and the child health, as well as tuberculosis. In tuberculosis control program, Nick Hoy, and in maternity and child health program, and they are connected by Kilkari and Anmol. So it is so strong that many of the rural people are getting help from this. I think this type of digital communication can be improved in other fields of medical science for improving the healthcare in the rural India. And the demands during the COVID was on the more and more use of robotics. All frontline health workers who are in direct contact with the patient had been exposed to major risk. So robot in the conventional is operation where surgeons come close to the patient. Now at present, with the robot, some of the surgeons or assistants come very close to the patient, but in future, all the human body, human person will be away from the patient. So that is the contactless robotic surgery, and that is possible in future, that will come. And this benefit, I have just searched the world literature. All over the world, the people are thinking, administrators and the policymakers are thinking, this type of facilities should reach to the rural India, And only by this, though initially that may be very costly, but in future when more and more demand will be there, cost will be less, and less number of experts can reach their beneficiary to more number of rural people by this communication of this contactless or other robotic surgery. So in conclusion, I like to say, for centuries, by combining engineering principle to the medical science, amazing breakthroughs has happened. Application of engineering and technological advances to medical wing with empathy can bring the revolution in healthcare, particularly in rural areas, as I have mentioned, as it happened in past in the field of agriculture and dairy. Regular meet and sharing of information among engineers and medical professionals is the need of the time to reach the goal at earliest. We should reach the goal what you, the engineers, and we, the medical professionals, in our mind and in our heart. And the obstacle in the path becomes the path. Never forget, within every obstacle is an opportunity to improve our condition, as Ryan Holiday said. Thank you, namaskar, for your patient hearing. And we can share our views with you. Thank you very much. Thank you, Dr. Bandyopadhyay, Aditi, and all the members who have joined in this session. Thank you. Thank you very much.
Thank you. Thank you so much, sir. We have a question from Dr. Varsha Kulkarni. Sonalika, is it possible for you to give speaking right to Dr. Varsha Kulkarni if you still see her in the participant list? So she has asked that the imported equipments are with single-use accessories consumables. We need reusable technology and regulation for its sterilization. I don't know what exactly she's trying to ask. Dr. Varsha, can you directly ask your question to Professor?
Yeah, actually it's not to him, but it's to you all.
Okay.
See, when I'm in Bombay, so we face different challenges. First topic is rural surgery, but challenges for him may be the same, because in laparoscopy and many other high-end surgery equipments, the foreign companies give us the reusable consumables. So we have to use one time and technically throw it. Though in India, we do EPO or do some gas sterilization and reuse it. It is not as per the norms. And when we are working in big institutes, we have a CAG audit, and also we technically cannot reuse it for microbiological reasons. And 50,000 one consumable, and we have to use on one patient and throw it. So it's their business strategy for foreign companies and their countries that it's like a glucometer, they'll give you free, but you keep buying strips. So we as country need to make instruments which are reusable with reusable consumables, and we should have a sterilization technology for proper reuse in the other patient. And that is a very, very dire need. That's what we feel in even in urban India.
Urban areas. Yeah. No, ma'am, that's a very valid point. And we have taken a note of it and added to our list of problem statements.
And you know, Aditi, as simple as cautery, like I'm making a tender on cautery, which is the daily use for any surgeon, and a cautery pad, which the best technology, what they tell us, is the disposable one.
Right.
Now, your engineers, you will understand what it means. And
Yes.
then it's every patient we go on spending 500 rupees. It's just waste of our money, which is going to other countries.
Right now.
Actually,
In fact, actually, we did have a group of students who proposed a better design for the electrocautery, because that also needs to be scraped off on a scrubber pad and something, which is time consuming, and it sometimes create infection, like cases of infections also. So yes, certainly, ma'am, that is an area of problem where we can urge our fraternity to work on, the engineering fraternity.
Thank you.
Yeah. Okay, if so, this is the last call for, if anyone has a question, please either raise your hand or put your question in the Q&A or the chat box. Otherwise, we would proceed ahead with giving a vote of thanks to Professor Sukumar Neti. Okay, Sonalika, can you give speaking rights to Suraj Kumar? Yes, Suraj, please.
Yeah, hi. So thanks for giving me the opportunity to ask a question. My question is that, so he talked about future robotic, basically operation procedures. My question was simple. That was, how does he see in next 10 years the same interventions in rural populations, let's say? Thought I can articulate it this way, that what role robotics is going to play in rural healthcare system in next 10 years. What are his views on that?
Okay, Sirai, I'm just telling, rural in the sense, suppose in a district or subdivision hospitals, the facilities for operation is okay, everything is there, and robotic is an extra addition instruments, and if someone technical person is there who is well aware of the system, then it is possible, because robotics is a type of robotic surgery, is a type of surgery where skill requirement is less than your laparoscopic and the open surgery, because a robot is so nicely fed, so it is said that it is easier. So if a person operate with the robot, a surgeon who has a knowledge brain, if he knows what he likes to do, he can do with robot. If particularly robotic surgery, said it is sometimes the surgeon who just taken retirement from the open surgery, he may remain engaged in the robotic surgery. He has the idea. He has the idea what is to be done. So in that way it is easy. And in rural India, in the district and subdivision level, it is possible. It is thought over. It is thought over. This is taken over. This is thing at the mind of the administrators too. Particularly, that may not be coming in recent future in India, but you see in America, in Australia, the rural population is even now more than 40 to 50%.
Yeah, right. Only thing is that Indian rural population is differently distributed, I would say, in terms of education, income, and even healthcare access. So my question was actually that where are we going to see things coming to change in next 10 years in rural population? But I get the point. Thank you so very much for the presentation. It was very nice.
Thank you, Suraj. And with that, we come to the end of the interesting session with Professor Sukumar Neti. Thank you so much, sir, for shedding light on the entire concept of rural surgery in general, and sharing some of the wonderful case studies like the glassless laparoscopy, and highlighting the need to innovate for the rural population of the country. Thank you so much, sir, for your valuable time. And I know you've been busy since morning for your surgeries, etc. Thank you so much, sir. We would certainly stay in touch, and so it would be great if you can share your presentation with us. That would be we would be sharing the presentation with all the attendees. I've been receiving some request on my personal WhatsApp message. If you can share the presentation, you can maybe hide the.
If you have recorded it, please send it. Or you have sent. It's probably.
Yes, sir. The session is anyway being recorded, and
you have a YouTube channel.
Yes, sir. We have a YouTube channel, and it will be posted. Yes. Okay.
Thank you all.
Thank you so much, sir. Thank you. Rohit, what you can do perhaps is I am sharing my email ID. You can post your question. You can email me your question, and then I will have it answered by sir, because we are slightly short of time and we'll have to end the session now. I've posted my email ID in the chat box. Please email me your question, Rohit. Okay.
So I'm leaving.
Thank you.
Aditi leaving. Thank you.
Yes, sir. Bye-bye, sir. Take care. Good evening. Good evening, everyone. And thank you so much for attending today's session. The link to the session recording has been posted in the chat box, so please feel free to give it a look at your leisure time. Thank you.